Volvovaginalis. It can be caused by three things. One is trichomoniosis, which is caused by Trichomonas vaginalis. Second is bacterial. Third is fungal. Coming to first one, which is trichomoniosis. It is caused by Trichomonas vaginalis. It exists in two forms. One is amoeboid trophozoite, another is flagellated trophozoite. So what we can see under the microscope, or what causes infection in the human, is this flagellated trophozoite. It is important to remember the flagellated trophozoite form of Trichomonas vaginalis causes trichomoniosis. The mode of transmission of this disease is through sexual contact. So sexually transmitted diseases through the secretions. Clinical features, it occurs in two phases. One is acute, another is chronic. So under acute, you can see this dysuria and also lower abdominal pain. So remember, under acute you will see pain while urinating and lower abdominal pain. You can see this discharge, which is yellowish or the greyish colored discharge, right? Purulent discharge, right? So later on chronic disease, if the disease is not treated properly in the acute stage, this purulent discharge can turn into mucus discharge. Or there will be pain while coitus, and pruritus can also be seen in the chronic stage. In stage of acute, you can also see the strawberry appearance of the vaginal mucosa, which is called Coliptus macularis. So the vaginal mucosa appears strawberry-like. The strawberry appearance will be seen, which is called Coliptus macularis. It is important to remember this Coliptus macularis. And also in the acute phase, you can see this yellowish greyish colored discharge. Into lab diagnosis, if you do the wet mount, you can see the trophozoites again, which are flagellated trophozoites can be seen, and the stains we can use is Jimstar stain and Papanicolaou stain. And also the stain is important to remember. And the culture is a gold standard, where you can see this where you can use flash cysteine hydrolysate serum. And antigen detection can be done through ELISA and ICT. Antibody detection can be done through ELISA. Molecular method, beta tubulin G. Here the WIF test is positive. That means if you take this discharge and add 10% KOH into it, you will get a fishy odor, which represents the positive of this WIF test. And also alkaline pH is increased in case of Trichomonas vaginalis, trichomoniosis, number of pusses. These three things are important to remember. So WIF test is positive, pH is increasing, that is going towards the alkaline side, and also pus cells can be seen. So this is the diagram of flagellated trophozoite. You have this 4 free flagella, and one flagella is attached through the undulating membrane, right? And also you have the central nucleus, cytoplasm, and food vacuole. Vacuoles are ingesting bacteria, so you can also see that. Coming to bacterial vaginosis. So before that, what are the things you have to remember here? One is flagellated trophozoite, another is yellowish greyish colored discharge. Coliptus macularis, that means the vaginal mucosa appears like strawberry. You can also see pruritus, right? So just remember, pusses are also increased. Bacterial vaginosis, you cannot see any invasion of newer organism, right? So you cannot see any infection or anything. The only thing you have to remember here is normal vaginal flora is altered. Gardnerella vaginalis, mobiluncus, lactobacilli, these are the organisms which are normally present in the vaginal flora. But the ratio of this is altered. It will be increase in Gardnerella, mobiluncus, and these are the organisms which are increasing in the number, and these lactobacilli are decreasing in the number. So when the lactobacilli are decreased, the acidity also decreases, right? So again the pH moves towards the alkaline side. So these are the points you have to remember under bacterial vaginosis. Again, this is not due to any new invasion by any organism. It is due to alteration of normal vaginal flora. That means the normal vaginal flora is altered. Some are increasing in number, some are decreasing in number. The lactobacilli is decreasing, that's why the pH is moving towards the alkaline side. As the lactobacilli causes acidity, is decreasing, the pH moves towards the alkaline side. And also under bacterial vaginosis, we have this Amsel's criteria. It is very, very important to remember. And under Amsel's criteria, the pH is increased, right? That means alkaline pH. You can see that in the bacterial vaginosis, you can see this whitish discharge. Positive WIF test. Again, WIF test is when you take the discharge and add 10% KOH into it, you'll see this fishy odor. Last thing you can find here is clue cells. This epithelial cells get surrounded by cocobacilli, right? So these appear like a granular structures. These are called clue cells. So under Amsel's criteria, you have to remember pH, which is increasing because decrease in the lactobacilli. Whitish discharge can be seen. Positive WIF test and also clue cells are seen. pH, whitish discharge, WIF test, clue cells. These are the 4 things that comes under Amsel's criteria. Lab diagnosis, the Nugent score, the Gardnerella, Lactobacillus, mobiluncus, everything will be greater than 7. Just write it. And also the culture, you can do it in the chocolate agar. So you can see this metachromatic granules, small pleomorphic gram-negative bacilli can be. Things you have to remember: alteration, Amsel's criteria, Nugent score, clue cells. Now coming to vaginal candidiasis, it is caused because of Candida albicans, which is a fungi. The presentation will be itching, erythema and cheesy discharge. This is very specific for fungal invasion. Cheesy discharge and dry white colonies are seen on SDA. Vulvovaginal soreness will be seen and also dysuria. The symptoms are some or the other common for everything, but you have to remember the specific cheesy discharge and dry white colonies in case of fungi. This answers criteria, Nugent score, clue cells, and alteration of vaginal flora under bacterial. So this is about vulvovaginalis.